Hi there. We'll be getting started in just a few minutes here. All right, we're going to get going here in about one more minute. We'll get started. All right, we're going to go ahead and get started here today. This is the third weekly live Q&A session we're doing on Facebook. Some of you may be watching this video live, while others may be watching it recorded after the fact. If you have questions while you're watching the video live, I encourage you to type the questions in to the window, and we'll answer those questions during the live session. The questions can be related to the topics we're discussing or completely unrelated. As long as it's a Medicare related question, we should be able to help answer that for you during this session. The first 2 weeks we had a decent turnout for these sessions and some good questions that came up. The first week we discussed what is Medicare and who qualifies. And the second week we discussed what does Part A of Medicare cover. And we also talked a little bit about the Medicare Trustees Report that was released last week as well, related to the Part A hospital insurance fund and potentially running out of money in 2026. So you can find those other videos on our Facebook page, also on our YouTube page if you're looking for the prior videos that we did there. And also, if you have any questions at any point, if you're watching this video after the fact, you can also send those to us on Facebook, or you can give us a call at the numbers you see on the slide. We can certainly help answer your questions. So, hey Clem, how you doing today? Thanks for reaching out. For today's session, before we jump into the content, I did want to just briefly touch on a testimonial email we got on Friday from one of our clients, which I thought was pretty interesting. And in this situation, and you can read through the email yourself here on the screen. But the bottom line is this was a client we helped out, a husband and wife, with their Medicare supplements probably about a year ago, and they were in good health, no major health issues, but they wanted good medical coverage. And we were very happy that we put them into the right plan for them. And unfortunately, they did have to use the coverage, as you can see in the email. And they got a bill from the emergency room and the ICU for $77,000 was the billed amount. Obviously, there's lower amounts that are kind of approved by Medicare and such, but the bottom line is they didn't pay a dime. They had $77,000 in billed services, and they didn't pay a dime because of Medicare and the Medicare supplement that we were able to put them into. He puts in his email, "You never think it can happen to you, but it does." And we didn't ask him to send us this email. This was completely out of the blue. Just one of our clients that, again, was happy with the coverage that we were able to help get them set up with. So we're going to talk a little bit more about Medicare supplements and Medicare Advantage plans in week 5, which is July 2nd. And we'll touch on that type of coverage in the future. So, all right. Well, Clem, I think you're the only one out there live today, so you have another opportunity. Oh, Liz just joined. Another opportunity to win another gift card here. We have the $10 Amazon gift card and $10 Starbucks gift card for today. And this question is going to be a topic we discussed last week during the Part A coverage table as far as what is covered under Part A of Medicare. And the question for today is, under Part A of Medicare, how many days in a skilled nursing facility after a hospitalization are fully covered by Part A of Medicare? So this, just to give you a hint here, Part A of Medicare also covers an additional number of days with a copay, but I'm asking for what are the number of fully covered days with Part A of Medicare for the skilled nursing facility after a hospitalization. And the first one that answers this correctly would get a free $10 gift card. Liz's guess of 3 days is not correct. I think you may be confusing the number of days you need to be in the hospital before being transferred into the skilled nursing facility in order to be covered under Part A. But the question is, how many days, once you're in the skilled nursing facility and you've met that qualification, how many days in the skilled nursing facility are fully covered under Part A of Medicare? And the next guess of 30 is also not correct. You're getting closer, but it's not 30. And Clem guess of 90 days is also not correct. We'll leave it out there for another minute or so, and then we may have to pass on this week. This is the fully covered days in skilled nursing after your transfer from the hospitalization. How many days are fully covered? And 60 is also not correct. All right, one more guess. All right, I'm gonna give the answer. There'll be no gift card for this one, but there's another question at the end for another gift card. The answer to this question is 20 days. So if you're transferred from the hospital after the 3 days into the skilled nursing facility for rehab, the first 20 days are fully covered by Medicare Part A. So there's no cost to you for those first 20 days in the skilled nursing. For the next 80 days, so for day 21 through day 100, Medicare Part A has a copay of $167.50 per day in the skilled nursing care. So the fully covered days are those first 20 days where you wouldn't pay anything. Then day 21 through 100 has that daily copay. So the correct answer was 20. So we'll pass on the gift card for today, but we'll have another question at the end of the session. As I mentioned earlier, this is our third session. We're going to be discussing what is covered by Part B of Medicare. And then we'll get into Q&A. So again, feel free to ask your questions throughout. throughout the session. So, all right, what is covered by Part B of Medicare? So Part A was everything inside of the hospital. Part B is outpatient, so everything outside of the hospital, your doctor's visits as well, testing, CAT scans, MRIs, expensive things like chemotherapy, kidney dialysis, durable medical equipment, infusion therapies would be covered under Part B of Medicare. The way Part B works in this table kind of shows you what are those services and how much Medicare pays. There's a deductible under Part B. This year it's $183, which Medicare does not pay. After that deductible, Medicare generally pays 80% for your Part B services. Okay, so again, we're going to talk about how Medicare supplements and Medicare Advantage plans work to help fill some of these gaps or lower some of your exposure in week 5, which is 2 weeks from today. But just understanding how Part B works, there's that deductible of $183, and then Medicare pays about 80% of the Part B expenses. There's also something called Part B excess charges. This is where doctors can charge up to 15% above the Medicare approved amounts for their services. Medicare will not pay for that excess charge. So if you do not have a Medicare supplement that covers that, you would be on the hook for the up to 15% above the Medicare approved amounts. With regards to blood, it's similar to what we saw under Part A, where those first 3 pints would be not covered by Medicare, but they could be covered by a supplement if you have a Medicare supplement. And then the next $183 are also not covered. That's also tied to that deductible for Part B. So if you've already met the deductible, you don't have to meet it for multiple things. It's once per calendar year. You have to meet that deductible of $183. But you will see it show up in different rows of this table, just because you could meet it for blood or you could meet it for some other Part B service. So once you've met that deductible, though, you're done for the year. Calendar year with the Part B deductible. After you've met that, Medicare will cover the 80% of the remainder of approved amounts for the blood. And then the clinical lab services, tests for diagnostic services are covered at 100%. So there will be no out-of-pocket for those tests. Clem has asked a question, which we can discuss now. So, am I correct that Pennsylvania doctors cannot charge Part B excess charges by law? That is correct. There are certain states out there that prohibit the charging of Part B excess charges. So, Pennsylvania is one of those states. The thing that we recommend people consider, even with the certain states that cannot charge the excess, one thing you just have to keep in mind is, even if you're a resident of Pennsylvania and you want to go to a hospital or a specialist in a different state with Medicare, you could still be potentially be exposed to the Part B excess charges. So while you're in Pennsylvania, you're seeing a Pennsylvania provider, they would not be legally allowed to charge the excess. But in other states, if you're going to a specialist or a hospital, hospital would be Part A, but if you're going to a specialist in another state, you could be potentially exposed for the Part B excess. So I hope that helps answer your question, Clem. All right. Well, at a high level, that is what Part B of Medicare covers, and that was the topic for today. Clem's next question: is there a place where I can find which states cannot charge excess charges? We'll send out a link after this session. I'll attach it to this video, Clem, for the states that prohibit the Part B excess charges. All right. All right. Well, you're welcome to ask other questions as we continue here. I'll go through the gift card, the second gift card for today. The first one, there was no winner. But let's go to the second one for today. The question in the first one to put the answer in the window is the winner. The question is, how much is the deductible for Part B of Medicare in 2018? And we just looked at this on the prior slide. So the first one with the correct answer will win the $10 gift card, either Starbucks or Amazon. And Clem is our winner today. It's $183 is the Part B deductible for 2018. So, all right. So Clem, I'll be in touch with you again on the gift card, and we'll make sure we get you the one that you're interested in for this week. So, Liz has another question here regarding how does someone sign up for Part A and B of Medicare? And there's really three different ways that one could sign up for Part A and B of Medicare, three different use cases, I'll call them. So the first one, if you're already enrolled in Social Security benefits prior to the age of 65, you will be automatically enrolled into Part A and B of Medicare. And Medicare will just send you your ID card about 3 months before you turn 65. That is if you're already enrolled in Social Security benefits. All right. The second example is if you're not enrolled in Social Security benefits, but you are approaching age 65 and you want to enroll in Part A and B of Medicare. There's a couple of different ways you can do it. The one we recommend is going right to Social Security's website, and you can enroll directly on Social Security's website. It takes about 5 or 10 minutes. That's probably the easiest way to do it if you're turning 65. Your other options are to go down to Social Security to enroll in Part A and B at 65, but that you may have a wait time, and it's just not going to be as simple as just going online to their website. If you're comfortable doing things online, that's what we normally recommend. You can also call in to Social Security and request the enrollment process for Part A and B over the phone. Again, probably not the most efficient. You may be on hold for 45 minutes to an hour, but that's another potential way when you're turning 65. The third use case, if you're working past the age of 65 and you need to enroll for the first time into Medicare, there's going to be two forms that are needed to enroll after age 65. One is a simple form that's the enrollment in Part B form, where basically the individual is filling out and signing that form saying they want Part B effective, August 1st or whatever date they want their Part B coverage. And the second form, which is more important, is the employment information or proof of coverage form, and that gets filled out by the employer, which provides proof of coverage since the individual was 65 years old. So the employer basically signs off saying that that individual was covered on the group health plan since they were 65. And the recommendation is that the individual brings both of those forms down to the Social Security office in the example that they're working past the age of 65, and they drop off those forms and let them know that they want Part B effective, again, August 1st, whatever, September 1st, whatever date they want for their effective date for their coverage. So those are really the three different use cases for how you sign up. Again, turning 65, if you're already enrolled in Social Security, you're going to be automatically enrolled, and they'll mail you your ID card. The second one was turning 65 when you're not enrolled in Social Security benefits, and we recommend doing that right on Social Security's website to enroll in Part A and B. And then the third example, if you're working past the age of 65, you really are going to need those forms showing proof of coverage, an enrollment in Part B form as well. And you can mail those in, but we recommend physically going down to Social Security and dropping those forms off to sign up. So I hope that helps answer your question, Liz, on how does someone sign up for A and B. And I'll leave it open here for another minute or so. We'll see if we get any other questions. And let's just go to while we're waiting here, we'll look at next week as well. So this week we just covered, let's see here. Okay, this week we just covered what is covered by Part B of Medicare. Next week we're going to talk about how much are the Part B premiums and what are the IRMAs, the income-related monthly adjustments. So we'll talk a little bit about how those are calculated, and ways you could potentially appeal an IRMA if you're charged an IRMA that doesn't seem accurate to you, those income adjustments on the Part B and Part D premiums. So we're going to discuss those next Monday at this time, and and open it up as well for more questions during next week's session. And some other resources that are out there, as you know, we'll do this each Monday at 10:30 a.m., anywhere between 15 and 30 minutes, depending upon the questions that come up during the session. You can also subscribe to our channel on YouTube, where we have about 15 videos out there on Medicare, and each of these videos also are going to be posted on YouTube after the Facebook Live session. And then we have a lot of content on our website as well. We have a full 90-minute Medicare workshop video, which is out there that can be watched and kind of give you a full overview of Medicare and the different parts of Medicare, a supplement versus an Advantage plan. How does Part D of Medicare work? All of that is in this full 90-minute video, and we're just kind of chopping up little pieces into these weekly Facebook sessions that we're doing on Facebook Live. We have a free Part D analysis form on our website where you can provide the RX information, and we'll do a free analysis to see which is the best Part D plan for each individual. We do blog articles monthly or sometimes even more frequently regarding Medicare and some things that are going on with Medicare. And we also provide quotes if folks are looking for quotes on their Medicare plans. We can certainly help folks out with that. So that is all I have for today. So if there's no other questions out there, we'll end today a little bit early. And I want to thank the folks that did join for joining, and for folks that are watching this after the fact, thanks for watching the video. And again, you can get more content from us by following us on Facebook and subscribing to our YouTube channel as well. All right. Thanks, everyone, and have a great week.